probably discuss after that. And the National AIDS Control Council wants the National Hospital Insurance Fund, NHIF, to cover people living with HIV/AIDS. Speaking at the Universal Healthcare Conference in Makueni, NSCC Director Nduko Kilonzo said the high cost of ARVs remains a heavy burden for 1.5 million Kenyans living with the virus. Sylvia Chebet tells us more.
Kenya records 72,000 new HIV infections. Besides grappling with the horror of infection, another reality hits the newly infected, that they cease being eligible for insurance cover.
We have to start thinking about covering the Kenyan and not the disease. Currently, we cover people for cancer. So the person living with HIV is going to an HIV clinic for HIV, but they are not covered. But when they go for another service, like, they're going for a cancer checkup or a checkup because they had a headache, then it gets covered. And that creates, first of all, it creates duplicate costs for the system.
The Ministry of Health estimates that about 2 million Kenyans sink into abject poverty every year because they are forced to sell virtually everything they own to settle medical bills. Health experts call it catastrophic health expenditure. But the Universal Healthcare Program in Makueni is changing things here. All patients, including those seeking HIV services, are able to walk in and walk out of the hospital without paying a shilling.
I cry for these people who take money out of their pocket and run this sector. They deserve better. They definitely deserve their right and they deserve quality. So how do we make sure that they get their quality? I believe, sir, that we must empower people with what you've just done here, a card.
Unfortunately, their burden is the country's burden, as the cost of their treatment is borne by the government. It would be prudent, therefore, according to the National AIDS Control Council's director, that the government gets HIV covered as well.
The cost of antiretroviral therapy per person per year is about 42,000 shillings. So if you do by 1 million people, you're talking about 42 billion.
Look, without health, all the other things fall apart. If you're unhealthy, if you are sickly, you cannot be productive.
The primary reason for investing in UHC is a moral reason. It's not purely economic. It's a moral reason that nobody deserves to suffer disease and death because they can't afford health care.
It is the exceedingly high cost of managing HIV in the country, among other factors, that has led to such a glaring poor performance in taming the virus in Kenya.
Because we are scoring 130 out of 140 countries. We are doing that badly in 2015-2016.
In fact, non-communicable diseases, I dare say, will probably bankrupt any of the insurance programs that we are thinking about having. If they are not, we don't invest in prevention.
It will take a collective decision and action to turn the tide around and end the HIV burden on the country and her citizens. Sylvia Chebet, Citizen TV, Makueni.